DIY COVID-19 cure and treatment still rising, experts say. Since the COVID-19 pandemic began, people have been looking for ways to shield themselves from the coronavirus. This led to the rise of poisoning cases that many toxicologists have to deal with, especially in the US. Julie Weber, president of the American Association of Poison Control Centers, said, "On average, we are getting over 40 to 50 calls per day, in addition to what we would normally get pre-pandemic." Of course, the pattern isn't always the same. ABC News reported that the threats change constantly. For example, there's been a rise in the number of calls for ivermectin. This medication is legit and used to treat parasite infections, but isn't approved for COVID-19. Some studies suggested that ivermectin could inhibit the replication of the coronavirus. However, in vitro, that's not enough to prove that the drug could do it effectively and safely in a person. More research must be done to support the repurposing of the drug for COVID-19. Once that information got out, many people bought ivermectin and took it without a doctor's consultation. Moreover, some of them are getting it through improper channels. Weber unveiled that one case involved someone getting ivermectin from a veterinary source. As a horse medication, the veterinary version has a higher dose of ivermectin than the human version. Exposures to cleaners and disinfectants also rose by 20% since March last year. Bleach has been the most commonly reported chemical in these cases. The rise in the reports is associated with the wrong application of these products. Instead of using them to clean and disinfect surfaces, some were applying them on their skin with one goal in mind: kill the coronavirus. Yet, they forgot that cleaners and bleach have ingredients that can harm the human body too. Dr. Joshua Nogar at Northwell Health even said that people are drinking hand sanitizer. Meanwhile, the US FDA took action and posted a warning in late January. The agency revealed that all alcohol-based hand sanitizers from Mexico were placed on import alert. The agency reasoned that tests conducted in these products showed methanol contamination. Alcohol-based sanitizers should contain ethanol or ethyl alcohol, not methanol. The latter is very toxic when absorbed by the skin or ingested by a person. Thus, methanol is never accepted as a component of hand sanitizers or other drugs. While experts understand the desperation of some, they urge the public to check products from credible sources like the FDA or CDC. They may also consult with doctors and federal agencies to confirm what they found online or in print.